DMH NewsLink, your trusted source for the latest in healthcare news.
DMH NewsLink.
This is DMH NewsLink. I'm your host, Michaela Hunt. And you know, in this day and age, there are a lot of ways to be able to contact your doctor, find out about test results, and so much more. We're fortunate, though, to have Erica Bobbitt with us with Clinical Informatics to talk to us about a specific way to access information called MyChart. So, Erica, thanks so much for being with us
Thanks for inviting me. I'm so happy to be here today.
So you're going to educate us a little bit, most definitely. Tell us what MyChart is and exactly how it works.
Well, DMH MyChart is a portal where the patients can go and they can look at lab work, they can schedule physician appointments, they can look at upcoming procedures and visits. They can even pay bills on MyChart. It's amazing.
How is it changing patient care, do you feel?
Well, it is actually saving the patients those several calls they make to the physician's office to find out lab work, to schedule those appointments, and they can just do it on their own time, you know, and they can wait for the physicians or their provider to get back to them with answers to their questions.
So very simple and straightforward way to communicate, it sounds like.
Yes.
You know, sometimes where we are in this place in time, we get a little worried about protecting our information. We hear a lot about data breaches. How secure is MyChart, since I'm putting a lot of personal information in there?
Yes, MyChart is actually very secure. You have to, of course, have your login and you have to have your own password. Usually when you sign up for a MyChart, you have an activation code. That's usually if you're discharged from the hospital or something that you get when you leave the physician's office. And you can use that activation code to sign up for the MyChart, and that will bring in your information automatically. You can also do it without the activation code, but you have to do a lot more manual things there.
Got it.
Yeah.
So tell me a little bit about test results and being able to access them. Is there a faster turnaround time for this kind of thing?
Well, like we said before, instead of having to call the office for it, they can just wait the allotted amount of time. Usually it's anywhere from 24 to 72 hours. They can get their lab work after they've had it drawn. And then there's also other labs and maybe even radiology results that they want. If they want those from the physician's office can manually push those into their MyChart so they can see them and have them.
Got it. So I'm a mom of two, and I know I can access my MyChart, but what about my kids? How am I able to get access to theirs or any other family members?
Well, with family members, there's family member access that you have to ask for. And it's called proxy access. And so that's for anyone 12 and under, 12 to 17, and then also adult to adult. So there's a few different ways to do that. You can go into any DMH office and ask for this form to be filled out. You can come into DMH medical records in the hospital, and also you can access that form online.
So tell me, I know we talked about activation codes earlier, but how exactly does a person set up their account if they haven't done that yet?
Well, you can use your cell phone, your tablet, or your computer, and you can just go online to dmhcares.com/mychart, and you can access your account. You can sign up for a new account, and you can also get that proxy access form from there, so it's pretty good. You just put in your information, your login, your password, things like that, and then if you have any questions or concerns with the login or any other questions, you can always call our helpline.
Because some of us are not that tech savvy at times, so it's good to have a place where we can call.
Yeah.
Erica, thank you so much for being here.
Oh, you're welcome.
And giving us a little bit of an education.
Yes, anytime.
Thank you. So to learn more, go to dmhcares.com/news.